Welcome to another Talking Feds one-on-one. The 1939 World's Fair famously featured a display on The World of Tomorrow, which gave hundreds of thousands of visitors their first ever glimpse of television. Today, we're visiting another World of Tomorrow, a mind-bending application of emerging AI technologies to medical treatment. And we have the best possible guide for it. I'm pleased to introduce my friend and neighbor, sort of, but also the one of the world's greatest authorities on this, Dr. Eric Topol. He's the founder and director of the Scripps Research Translational Institute. Did I say that right?
Yes.
All right, and also professor of molecular medicine and executive VP of Scripps Research. He's published over 1,200 peer-reviewed articles, more than 300,000 citations. He's in the National Academy of Medicine, one of the 10 most cited researchers in all of medicine. All right, and he has of late really been interested in the application of AI, not to specifically the sort of one-to-one doctor-patient relationship, the practice of medicine, as opposed to the big clinical breakthroughs. But I will let him explain it. Dr. Topol, Eric, thanks so much for being with us.
Well, Harry, it is great to be with you. And it is such an exciting time in the practice of medicine. I mean, it's just happening so quickly now. And I feel lucky to be a participant in seeing patients to be able to start to get this AI rescue, if you will, going. One of the
And well, let's start there. So rescue from what? We have a particular problem. By the way, we'll put up a link to a really great and pretty compact TED Talk that Eric's recently done. But you begin with the problem of diagnostic errors in everyday medicine. Yes, can you explain how bad that problem is now? How are we in the Middle Ages basically, and we just don't know it?
Well, there's two major fronts. One of them, of course, is, as you say, diagnostic medical errors. And the other is about getting rid of the data clerk keyboards in medicine and bringing back the face-to-face contact. Now, on the medical errors, yeah, it's really bad. And we have 800,000 Americans each year who have significant disability or dying because of diagnostic medical errors. And so we have to get that down. And, part of it is, Harry, there's a big rush in seeing patients, and there's not enough time to really process. And the diagnostic error rates are improved, that is reduced, when a doctor has a time to really reflect, the system two thinking, if you will, really go over all the data, go over the literature, but that's rare these days. So part of it is that.
Well, I want to get back to that, but let me start with what seemed to me to be technological obstacles of being human, because some of the imaging work that's being done by AI, to me, couldn't be replicated by humans with all the time in the world. I'll give you one example if you want to follow up on it, because it really struck me, which is the ability for AI imaging to detect gender through just looking at eyeballs, something I assume no human being ever could do. But so
Yeah.
that's a big part of it. Yeah, could you explain that?
Yeah, so exactly. There's machine eyes that can be trained to see things that human experts will never see. And so what you just cited is that when you give retina pictures to leading ophthalmologists, even retinal experts, their chance of saying if that's from a man or a woman is 50%, whereas the AI that's trained gets it accuracy of 97%. We don't know why or how, but clearly AI is seeing things in the retina. It can detect, heart disease. It can detect kidney, liver, biliary tract.
Wait, all of this is just the retina.
That's the retina. And then if you look at chest x-rays, improving accuracy, or any type of medical scan, electrocardiogram, you pick up things that human eyes will never see. So the diagnostic accuracy from imaging is going up substantially through the trained AI, the so-called supervised deep learning. But it's actually gone to another phase right now, which is this transformer model, which is what accounts for ChatGPT and
Yeah.
GPT-4 and these other. That's what's taking it to another level because it integrates all of a patient's data, their electronic health record, their images. And so it's taking accuracy to much better rates than we've ever seen. And it's still got a ways to go, of course.
Well, that first, I did want to ask you about that because I think of ChatGPT. It seemed like a week ago that my kids first brought back this brave, New World maybe or Orwellian maybe device, and just we started typing things in. And I know even in the 6 months since then, it's grown or advanced by leaps and bounds. So this must be something that is improving, in real time, and you're probably personally seeing by what, every year, every 2 years. I mean, we're really what's a very recent advance that you first learned about?
Well, I mean, I think what's striking is that patients or family members are putting in all the data on a complex patient. One of the most recent
Yeah.
ones that's extraordinary is the 6-year-old boy who went 3 years with an inability to walk and growth development issues and just horrible pain. And for 3 years, seeing 17 doctors and having all these workups, there was no diagnosis. Then his mother put everything in the chat GPT and she gets the diagnosis of a spina bifida that was occult. And we had a neurosurgery consult with that diagnosis in hand. And indeed, it was a tethered spinal cord that was released, and this boy is doing really well. But
It's a miracle, right?
yeah,
And
yeah.
yeah.
And that's democratizing. That is, anyone can use these large language models. And what's even more striking than anecdotes like that, of which there are many now that are accruing, is that now there's been systematic studies. So in the New England Journal of Medicine, every week or every other week, there's this thing called a CPC, which is a clinical pathologic conference, and the most complex patients are presented to master clinicians of that field. And they have to get a differential diagnosis of what could this possibly be. Well, now AI is doing as well as the master clinicians in hundreds of these CPCs. And who would have predicted that? And that's
And there are dozens of documented cases that were inscrutable even to the masters that AI have been able to crack. Yes, some,
yes. Well,
each of these is Promethean in the way the 6-year-old boy is. It's just like complete life alteration. Yeah,
yeah, and then, testing this against internal medicine doctors with almost a decade of experience,
right.
the AI is outperforming them in making diagnoses. And so, of course, the best of both worlds is combining what you can get from the AI and the wisdom experience of a doctor to just rev up the accuracy, uh, and leave this problem of undiagnosed misdiagnosis, start to really eradicate it. So that's where we're headed, and it's something that hasn't happened. We haven't seen, Harry. The real thing is all these years since the National Academy of Medicine put out this report almost a decade ago that all of us were going to have a serious diagnostic error in our lifetime, at least one. And so, what was being done in the last decade? Let's do more scans. Let's do more tests. Nothing has helped. This is the first time we've seen a relief or a trend of trying to get the accuracy up.
It's amazing. And I know a big part of this is improvements to the doctor-patient relationship, but I still want to stick a little bit more with the Brave New World. So you just suggested that you bring the best of both worlds, you free up time, and so the human intuition or what's ever developed can also be brought to bear. Are there identifiable cadre of cases, in fact, that AI can't do, but humans can?
Yeah, I mean, I think what's important here is, not to give an overglowing report of AI that
Yeah.
it's a miracle, but there are cases
Sure
where
looks like it to me
AI,
from your TED Talk. Everybody listen to Eric's TED Talk. I'm serious. Go ahead.
yeah, the AI can certainly make mistakes. And and not include the diagnosis in the differential. But remember too that our models like GPT-4 are going to just keep getting better, and they haven't been ever specifically medically trained, supervised, fine-tuned. So the expectation is the errors that we're seeing, they'll call hallucinations or confabulations, we'll see much less of that over time. So yes, and of course we have biases because of our embedded social,
Yes.
cultural issues. And so that's where the mistakes can be made, but that's not so much on the AI, that's on us. The content that's basically the inputs for these large models.
Gotcha. Still sticking just a little bit with it, I was really struck by something that I think is maybe beyond the ken of medicine today, or maybe it's just not done, but the ability to predict longitudinally long events in the future, pre-diabetes or possible cancers. I mean, it seems like for early detection, this blows everything we've ever been able to do out of the water. Is that fair?
Yeah, I mean, that's another dimension that is unexpected about the power. So, one of the many studies that have come out that we've been part of is looking in the retina to say in the next 5 to 7 years, even though you don't have any symptoms of Parkinson's or any symptoms of Alzheimer's, the risk is high or the risk is low. And looking at a cardiogram and saying you're at risk of developing diabetes from a cardiogram. So we're seeing the routine tests that we do yield, there's so much more there because we've not been able to see this stuff. And so
And have we largely stumbled into these results, or are people out there saying, cardiogram, diabetes,
yeah,
how are we even stumbling on it?
yeah. So you're asking such a great question, Harry, for being non-physician. It's pretty impressive. The issue,
My podcast every week someone will say, I am not a lawyer, so let me put in, I am not a doctor, but how is this done? Yeah.
yeah. So this is what's interesting. In the first phase of deep learning AI, you had to have imagination to ask the question and make this link. Like, could I find the risk of Parkinson's way out, 5, 7 years later from the retina? You had to ask the question. But now in these transformer foundation models, you don't even have to ask. You can just say, give me all the conditions. If you have millions of people with their images and then their follow-up, you can just say, give me everything that happened to these people and how did you predict it? So that's what's advancing is you don't have
Here's the DSM-4 discuss,
yeah, but
basically.
uh, you know,
Amazing. Okay.
there were all these different studies that had to use imagination, and now you can do like we just recently published in Nature. You just do it all in one because you basically have multimodal AI that's happened so fast. This is really what is exemplary of the GPT-4 from March of 2023 is that for the first time we can bring in every type of mode of data, whether it's video or audio, images of scans, and of course, all the electronic health records. Even the unstructured text that's in your records can be integrated to help make these calls. Like, for example, picking up the risk of pancreatic cancer years before. This is one of the most difficult diagnoses to make, and it's
My
usually
mom, yeah, Ruth Ginsburg, right.
made very late, when it's stage
Yeah.
3 or 4.
Yeah, it's almost always stage 4, right?
Yeah,
Yeah.
and so you could pick it up from the unstructured text and electronic health records. I mean, it's extraordinary. And the same thing we're seeing with ovarian cancer, which is really hard to diagnose early or risk. And so this is potentially, Harry, upending how we do cancer screening. So right now it's so dumbed down, we just use age. But in the future, we'll be able to say any individual, your risk is high. We're going to do more intensive screening for this particular type of cancer. So that's what's exciting. It's changing, kind of resetting the way we do things for screening people for serious conditions.
It sounds like you must be publishing as fast as you can print things out. Let me just try to get a sense, and it'll probably be different in 2 days when this is published. But where exactly are we with, especially these just over the horizon technologies and applications? And if I go, my mom died of pancreatic cancer. I would love to have that early screening. Is it something that if I were to walk into a regular clinic, I might get? If I were able to walk into yours, I might get? Or is it still, in terms of on the ground availability for patients, a little far away?
Yeah, that's a really important point. What we're seeing are papers that are published from, top
Yeah.
health systems and researchers, but we haven't seen the implementation. One of the reasons for that is that it has to go through regulatory reviews. There has not yet even been a multimodal AI uh, approved by FDA for general use. The other thing is, of course, that health systems have to adopt it. They have to basically make an investment. They have to set up systems of surveillance in case there's an adversarial attack or issues about
Oh, right,
privacy,
of course, yeah.
security. There's degradation of models that can occur over time. So what we have now is, paving the way, but it's going to be a few years before these get into general medical practice and
But a
predict.
few years, you would say, so not
Oh,
that long.
yeah. Yeah.
And I didn't realize, so even diagnostic tools, I can understand medical treatments, but even diagnostic tools have to get FDA approval. If you've got some special thing that you do with a rubber band, whatever, you can't just do it. You have to. I see. So that
Well,
really
it
changes.
depends. So if it's diagnostic, if it's changing the medical
Yeah.
assessment or treatment, yes. If you're just using it to make a synthetic note from a conversation in
Hmm.
a clinic visit, and you're using that, which is another really important advance, that doesn't require an FDA oversight.
And what do you think? And you're I'm sure you're living this month to month. How's the FDA doing here? Is the government pretty much uh, all in, up to speed, not an impediment, or are they actually kind of another obstacle?
This is really a tough one because the FDA is trying hard,
Yeah.
but so far they've been a sieve. That is, there's 650 AI medical algorithms that have been cleared or approved. And almost all of them, maybe 600 of them plus, are retrospective small studies that have never been published. So the medical community can't see the data and can't develop trust. They're opaque.
I
And
see.
so the FDA doesn't have the teeth to say, you got to publish this stuff. The companies are saying it's proprietary, and we're not going to get really the anchoring to advance unless we have more transparency. So yes, there are some areas, like for example, colonoscopy, where you can pick up polyps much better, or mammography, where you can get the scans much better interpreted. But a lot of these don't have the kind of large prospective randomized studies that we need to have confidence, and that we can, as physicians, review the data and buy into it for our patients. So this is a problem. It isn't that FDA isn't trying hard, but they've had a low bar, and they don't push these companies to make their data available for the medical community.
And what about other countries? Are we competing with them like the moon race, or cooperating with them as, in other models? Yeah, how is that working? There must be some countries who are getting pretty well developed here now,
Well, China is
for example.
very much into
Yeah,
this. And
right,
part of it is out of desperate need because their ratio of physicians to
right.
people is, altogether different. So they have basically accepted the use routinely of many of the algorithms we're talking about. But it's a nationalism story. The UK wants to be the world leader, the
Yeah.
US wants to be the world. So there hasn't been a lot of cooperation, really.
All right. God, we could talk about this for hours. I hope we will. Let me just close out though with a point that is a real theme of the TED Talk, which is how this has the potential for transforming and really improving, or almost devolving, I could say, the doctor-patient relationship that people grew up with the the doc showing up and spending all the time and, bedside manner, which seems to most people, certainly to me, to have virtually disappeared. You're in a hospital and you wait all day and hopefully you're there when the doctor comes in and has 4 minutes. So your sense is that a real possible collateral benefit is a transformation in the doctor-patient relationship. Can you elaborate?
Yeah, I actually think this is going to be more important than the improvement in the accuracy or the prediction that we talked about. And that's because, as you pointed out, and I'm sure you know firsthand, there's been terrible erosion of that relationship, which is critical. That human-to-human bond, that trust in your physician and who knows has your back, is so critical. And that's because we miss the time and the ability to have face-to-face contact and the real presence, a careful physical exam, all these features. So what we can see here, which is fascinating, is we can get back the gift of time because there's so much efficiency with AI that's promoted. And then the ability of AI to take the visit, the conversation, and make that into an exquisite note, which is what's really amazing here. That note, which is automated for the first time, is far
Right,
better
you
than
don't have to
the
write
notes.
it down even,
Yeah,
right? It just
yeah,
happens.
it's far better than the notes that are in all medical charts today.
Right,
Now,
right.
and of course, the patient then gets the file so they can clear up any confusion or things they forgot. They can just go right to it. But what's great is that automated note, not only can it help with all the downstream functions, like dealing with insurance companies without any doctor involvement or new appointments and procedures and lab tests and nudges to the patient, did you check your blood pressure or this or that? But what else is it can train doctors to be more empathetic and say, why did you interrupt, Mrs. Smith after, 8 seconds? Why didn't you listen or try to, find out what her real concern is? And so you can use these notes to promote empathy. And the machine doesn't know empathy, but it can promote it. And so I wouldn't be surprised, Harry, is in the times ahead, all physicians will have to have machine coaching. Who would have ever thought that? But between the gift of time and direct promotion of empathy, we're looking at a whole different potential for the patient-doctor relationship to go to restore to where it used to be, in the 1970s and before that time.
What a cluster of advances. I'm sure that it raises. I'd like to have several more conversations, but one would be, what are there ethical shoals that people worry about? But this is really remarkable. Again, check out the TED Talk, which we've put in the link here, and we'll hope to talk to you again, at the next advance, which is best I can tell might be Thursday. Thanks so much for explaining this incredibly exciting new world in medicine.
Oh, thanks, Harry. Really enjoyed and have the conversation with you.
Thanks for tuning in. If you enjoyed this video and other Talking Feds content, please take a second to like and subscribe. Talk to you later.